Hello everyone. Today we are going to remember we are just in our end portion of this course. We will complete the text and the course will be completed. So today we are going to start a very interesting topic and very important topic, that is homeopathic posology. We have completed intermittent diseases, and now from here onward you will see that homeopathic posology will be started. Okay, so there have been lots of discussion in between in previous classes that how this posology, wait a minute, how this posology have evolved, Hahnemannian posology have evolved throughout the time period of Hahnemann's life. Okay, initially it started with the crude doses, then went with the, one second, give me 1 second. Okay, the chair was moving a lot, I have to fix it now. We have discussed that how Hahnemannian posology have developed throughout the time period of Hahnemann's life, from the pre-first edition era, that is from 1796 when Hahnemann have declared his pathy, to 1843 post 6th edition era. Yeah, that means 6th edition have been written. In 1842 it was completed, and it was unfortunately was not able to publish during the lifetime of Hahnemann, and it was published after a certain delay. That is a history. We won't go in detail as we have discussed it somewhere else. So you see that how this period from crude doses to LM potency and the olfaction have been there throughout the time period of Hahnemann, from 1796 up to when he discovered around 1797 or 1798, he discovered the homeopathic aggravation. Okay, and this was homeopathic aggravation, that original disease was aggravated, and this was the thing which prevented previous authors previous than Hahnemann, prior to Hahnemann, which constrained them to not use this homeopathy because they have seen this kind of aggravation of original diseases. Okay, but Hahnemann was, I hope you understand what I'm trying to say. This homeopathic aggravation which Hahnemann discovered in 1797 with the Veratrum album and the case of polycodynia, this actually homeopathic aggravation have been observed by previous authors also, and this homeopathic aggravation have prevented them to use this homeopathy as a method of treatment. Okay, because they were afraid of this homeopathic aggravation. But Hahnemann was a firm believer of similia similibus curanter, so he went on to solve this problem and went on to reduce his doses, okay, from material to infinite doses, infinitesimal doses, smallest possible dose Hahnemann was discovering or experimenting with. And in 1801 Hahnemann wrote an article of small doses of belladonna where he prevented the scarlatina and cured many scarlet fever cases with belladonna in smallest potency. Okay, so from there onward this doses was moving on to the level of infinitesimal, means there would not be any single molecule of medicine will be present in the solution. Okay, so now this idea has an opposition with the this idea was having a favor from some of the disciple of Hahnemann and from opposition from some of the disciple of Hahnemann. Those who are more materialistic minded, they oppose to this idea of going to infinitesimal. Okay, and there Hahnemann himself at some point of time is talking about when one of his disciple told that look, I have given this this medicine in highest possible potency and it's working. So Hahnemann was very excited with the news, but he told him that there should be some limit from beyond that point that medicine won't work. There should be some limit. Okay, so Hahnemann was also very cautious in ascending the scale. Initially, we have seen some letter of Hahnemann to his disciples that there should be some limit. Don't go with the highest and highest and highest. So in 5th edition, we see that Hahnemann tries to fix the potency problem with the 30. In the 4th edition, sorry, in 4th edition, Hahnemann tried to fix this potency problem with 30. Okay, but this 4th edition was published in 1829 and the 5th edition was published in 1833. From 4th to 5th edition, Hahnemann gradually ascends and limit of 30 was removed. Okay, you will see in 5th edition, here in the 5th edition for 246 footnote, that this limit of 30 was removed and limit of repetition was also removed. Before that, in 4th edition, those who are 4th edition prescriber, basically Kent and his followers, they believe in one single dose and wait and watch. Okay, but Hahnemann have discarded this method in the 5th edition and discovered that there may be some repetition if needed in slowly progressive cases. Okay, so solution medicines came. Medicine solution means 100 ml bottle, 1 drop of your medicine, and ask your patient to repeat when needed. Okay, means as per your experience, as per you observe the case, how gradually or how slowly it is progressing or how rapidly it is progressing. So these are all the matter. Posology consists of basically 3 things. Okay, posology consists basically of 3 things. Number 1 is doses. Okay, that is doses means potency. 30, 200, 1m, 6, 3, crude or infinitesimal. Okay, so number 2 is repetition. Okay, posology consists mainly of these 2 things, doses and repetition. And third is the effect of remedy on which depend up our repetition. Okay, that effect of remedy you are going to judge that how your medicine have acted on a case, whether it has increases the present complaint, whether it has decreases the present complaint, whether it is ameliorated, where it was aggravated. These effects should be judged by you. Effect of remedy. Now depending upon this effect, okay, whether the amelioration was progressive or rapid or slow, on this observation of the effect of remedy, you will decide the repetition. Okay, so doses, repetition and effect of remedy, we will study in line. Okay, first we will study these doses and repetition. Okay, then we'll study the effect of medicine. For the knowing the effect of medicine, you have a certain observation of Kent, that is 12 observation, second prescription, Stuart Close have discussed this in the chapter of Posology itself. Roberts have discussed in the chapter of remedy reaction, and Hahnemann have discussed in Organon of Medicine in improvement science of improvement. Okay, depending upon this science of improvement, you are going to repeat or decide whether to repeat or not to repeat your medicine. Okay, remember this is for 5th edition, but the 6th edition is more liberal towards repetition. Even if there is remarkably amelioration, even in that cases you can repeat for the 6th edition, and the potency for the 6th edition is LM potency. Obvious that LM potency is a new scale and totally has a new criteria for application of it. Okay, so that is a different thing. We will discuss separately how to prepare LM potency dilution, how to prepare LM potency olfaction. We will discuss it separately. Now 245. Having thus seen that what attention should in homeopathic treatment be paid to chief varieties of disease. Okay, underline this: chief varieties of disease. Chief varieties of disease have been discussed: mental disease, intermittent disease, skin disease, external diseases. Okay, all have been discussed along with the chronic disease, acute disease, artificial chronic disease. So, having thus seen what attention should in homeopathic treatment be paid to chief varieties of disease and the peculiar circumstances connected with them, we now pass on to what we have to say respecting the remedies and the mode of employing them. Underline this. Together with the diet and regime to be observed during use. Together with the diet and regime. Underline this. Now, this second paragraph. Every perceptible, progressive, and striking increasing amelioration in a transient or persistent is a condition of persistent disease, that is chronic disease, is a condition which, as long as it lasts, completely precludes every repetition of the administration of any medicine whatsoever. Underline this. Up to this, underline. Now this, see, this paragraph have been totally removed from 6th edition. What does this mean? This means that even if there is striking amelioration, you can repeat your medicine, LM potency. There is no basis in the argument of people who are saying that this is an NIH method and have been developed in NIH. Okay, in NIH, those who are from NIH, National Institute of Homeopathy, Kolkata, should know that in NIH we prescribe LM potency 16 doses at once to the patient and ask the patient to take the whole medicine on daily basis, regular daily doses, or BD or alternate day. Okay, we ask our patient, depending upon the case and our judgment, we ask the patient to take the medicine daily, LM potency. Okay, so this is actually coming from here, from this aphorism. Even if there is a striking amelioration, that doesn't prevent the repetition. Okay, that is why this paragraph have been removed. There may be some instances, we will discuss that in LM potency, that LM potency need not to be repeated. But those who are saying that single globule of LM potency dry on tongue is enough to cure the case, maybe they have seen, but we don't have such observation. Neither I am having, nor my teachers were having, and neither any of the physician practicing in an IH OPD seeing hundreds and thousands of patients daily, neither they have such observation. Okay, those who are saying that they must register it and publish the case to the world, just saying for the sake of argument has no basis. Okay, so this method has not been developed and NIH has been wrongly actually have wrongly attributed for a wrong reason. Okay, so this LM potency can be repeated even there is striking amelioration. That is why this paragraph have been removed. There are some confusion. From where the confusion is coming, we will discuss when we will progress with our aphorisms. Okay, so all the good medicines taken continues to affect in new hastening towards its completion. Every new dose of any medicine whatsoever, even of the one last administration that has hitherto shown itself to be salutary, would in this case disturb the work of amelioration. Okay, and there is an asterisk that indicates that this paragraph is totally omitted in 6th edition. Okay, has there been some value with this statement that LM potency should not be repeated when there is even the amelioration, striking amelioration? This paragraph should be there in the 6th edition too, but this was removed. Now 246. Now I want to emphasize on the word progressive, striking, increasing. Okay, amelioration. Now give emphasis, give the highlight to these words, and now come to 246. On the other hand, the slowly progressive amelioration. On the other hand, what was that? Progressive, striking, increasing amelioration. Now slowly progressive amelioration consequent on the very minute dose whose selection has been accurately homeopathic, when it has met with no hindrance to the duration of its action, sometimes accomplishes all the good the remedy in the question is capable from its nature of performing in a given case in period of underline 40, 50 or 100 days. Okay, if you want to say your patient, if your patient asks Dr. Babu kitna time lagega, you can give a limit of, देखिए 3 महीना तो मिनिमम खाना पड़ेगा. Okay, 40. This is what a chronic case will start to respond. Means statistically, if 1%, 2% patient coming to you and saying that Dr. Babu 1% सही हुआ, इस 1% को 10% होने में कम से कम 3 महीने लगता है. अगर इतना स्लो amelioration, इतना slow amelioration है, next visit में patient is saying that just 1% have been relieved, and this 1% will go to 10% in 3 months, at least 3 month time. This is however but rarely the case, and beside it must be matter of great importance to the physician. Why rarely the case? This progressive, this slow aggravation, slow amelioration is producing result. Okay, slow amelioration is producing result. This is however very rarely. If the amelioration is slow, you have to intervene. Okay, and beside it must be matter of great importance for the physician as well as the patient that where it is possible this period should be diminished, underline this, 1/2, 1/4, even it less, even still less, so that a much more rapid cure might be obtained, underline this. And this may be very affected as recent and often repeated observation have shown, underline this, often repeated observation have shown, often repeated observations have shown under 3 conditions. This 3 condition is important. Okay, first, second and third. This is a university question for those who are in BHMS. This is their university question. What to do to increase the rapidity of course? This when the course cure is rapid. This 3, 1, 2, 3. You should remember. And 3 businesses of physician is a totally different thing. That is also a question for your UG examination. 3 businesses of physician. That is aphorism number 71. And this 3 things to do in order to increase the rapidity of cure. Firstly, the selection of the medicine should be as possible as nearest to the simillimum, homeopathic. Okay, see, partial simillimum is also producing result. You know, this is point of cure and this is your point of start. Okay, from this you are going to this. This is similimum. One single line between 2 points. Okay, this is similimum. Okay, and covering the displacement, minimum possible distance. Okay, now if you are giving your partial similimum, cure will be in zigzag manner and the distance is much more. This one line is actually displacement in the language of physics, and this one is distance. That indicates the zigzag cure. Okay, clear? So it should be similimum. Okay, now sorry, it's not. Now that aggravation. Third is, if the similimum rapid, cure will be rapid. You give a case of belladonna, it will cure rapidly. But if a case of belladonna you are giving rust ox, then you will need bryonia, then will ultimately will prescribe belladonna and the cure will be there. So 3 visits and there is a cure. But belladonna, it's instantly working and rapidly curing the case. Okay, so firstly, if the medicine selected with the utmost care was perfectly homeopathic. Okay. Secondly, if it was given in the minutest dose, so as to produce least excitation of the vital force and yet sufficient to effect the necessary changes in it. Least excitation. Why we bother about least excitation? Because if there is aggravation, too much aggravation, then it is coming back and then going to normal. Okay, so coming back and going to normal will take time. But if there is least aggravation and then coming back, okay, so least possible aggravation, smallest dose. Okay, if you are giving in high dose, here doses means crude and infinitesimal. Okay, smallest possible dose. Thirdly, if this minutest yet powerful doses of the best selected medicine be repeated at suitable interval, underline this, this is important. Third, repeated at suitable interval. Okay, repeated at suitable interval. So repetition is needed to rapid the cure. Okay, see, this is 5th edition. In 4th edition, there was that you should not repeat until and unless the previous medicine has stopped working. But in the 5th edition, repetition was allowed in cases where there is improvement is slow, and many of your cases will fall in this category where you can repeat according to 5th edition. What we generally do in practice, we are using both 5th and 6th edition. In 5th edition, if you are following 5th edition, you are going to give a fractional dose. Okay, you are going to give this bottle of your medicine, 100 ml bottle, and making with a few drops of your medicine and few drops of RS. RS is given as a preservative. Okay, RS and Hahnemann have mentioned also, those who are preparing for their PG entrance, they should know that 2 things Hahnemann have recommended for preservation. One is charcoal. Okay, so in modern days we are not using charcoal, we are using RS. RS is rectified spirit. Okay, so RS is given for the as a preservative. We are using distilled water plus rectified spirit. If you are using normal tap water, you should give a bit more RS to preserve, because it will the fungus will grow in the water without rectified spirit. A rectified spirit is acting as a preservative for your medicine, so that the medicine will work at least for a month. Okay, you are giving 100 ml of distilled water, few drops of your medicine and few drops of RS. Medicine is ready, medicine solution is ready, and you ask your patient to take from it daily or twice daily, thrice daily, OD, AD as per requirement, often repeated. In acute cases, you will see at one of the M.L. Tyler's book, Pointers to the Common Remedies. Pointer, I think if I am not wrong, it is Pointers to the Common Remedy, where she in every disease, she is telling that repeated every 4 hours. Repeated, though she was a Keynesian, but she was more towards Hahnemann. You will see that the Materia Medica of M.L. Tyler is also not carrying that much picturization as that of later authors who have just picturized everything, and less and less of symptoms and signs are there. Okay, so that is a side topic we deviated from. So M.L. Tyler was in habit, from her writing, we can see was in habit of repeating, in acute cases was in habit of repeating every 4 hours till the condition improved. If the condition start improving, increase the interval, time interval. Okay, so this was often suitable interval, often medicine be repeated in suitable intervals. Okay, so this carries a long footnote. It is one of the longest footnote in Organon. It is one of the longest footnote. I will ask you to just give the paragraph numbers to those paragraph number. There is at least I think there is at least 19 paragraph to this. Okay, just give the paragraph number to each of the footnote. Which experience shall have pronounced to be the best adapted for accelerating the cure? This will be the question. What you should do to accelerate the cure? Underline this. To the utmost extent, yet without the vital force. Yet without the vital force which it is sought to influence to the production of similar medicinal disease, being able to feel itself excited and rose to adverse reaction. Okay, that is homeopathic aggravation. Now this footnote, paragraph number 1. Paragraph number 1 is a general discussion that in the previous edition of Organon I have asked not to repeat, but that was due to the knowledge I have gained till then. Now I have advanced knowledge and I am saying this. Okay, in this fractional doses is actually also not propagated in 5th edition. That fractional doses, this kind of doses has been later on included in chronic diseases in 1838. Okay, here it is also Hahnemann is talking about solid doses or without any mention of solid or liquid doses, but fractional doses specifically, or plussing method specifically have got it mentioned in chronic diseases from 1838. Okay, from that 1838 to 1842, 4 years of experience have taught Hahnemann the LM potency. Okay, and that was included in the 6th edition. So this is a paragraph in general. General discussion has been there. Underline C, non juvat modo ni nociet. Underline this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. 14th line. C non juvat modo ni nociet. This is actually, this is what? A Greek aphorism or a Greek quotation of Hippocrates. If you cannot do some benefit, you should not do harm. If you cannot do some good, at least do not harm. On the other hand, number 2, paragraph number 2. On the other hand, however, practice shows us that a single one of these small doses may suffice to accomplish almost all it was possible for this medicine to do under the circumstances in some and especially slight cases of disease. Underline this. Single dose, underline single dose, may suffice, underline, in slight cases of disease, underline. Okay, again comma. So problem with the organon is these are long sentences, complex sentences. You will see that one sentence is running throughout the paragraph. At least this paragraph is consists of only 2 sentences, and the previous paragraph was a single sentence. Okay, so the problem with the organon is long sentences. आधा पढ़ा, आगे जा रहे, पीछे का भूल गए, क्या समझा क्या पढ़ा नहीं समझ में आया. So you have to break it in small part and underline the important keywords to understand the aphorisms and its footnote. So single one of these may suffice in slight cases of disease, particularly in those not only very particularly in those young children, very delicate and excitable adult, yet that in many, indeed almost cases, not only of very chronic diseases that have already made great progress and have frequently been aggravated by a previous employment in appropriate medicine, but also, underline this, previous employment of inappropriate medicine. Underline this. What is this? Okay, up to yet, just give a circle to yet. Okay, from yet, another section is being started. From before yet, Hahnemann is saying single dose may suffice for these cases, delicate cases, children, young adult of delicate nature, they may suffice, they may get cured with a single dose. Yet, in these cases, most cases, not only very chronic disease that have already, this again negative sentence, you have to understand that chronic diseases included, have already made inroad, have already made great progress and frequently been aggravated by a previous employment of inappropriate medicine. Underline this. What is this previous employment of? Previous employment of inappropriate medicine. What is this? Creation of artificial disease. This artificial disease you will be facing again and again in your clinic. Okay, so at one point of time I read in Stuart Close, I think that this too much employment of allopathic medicine increases the susceptibility and high potency is required. I don't remember where I have read, but this statement is attributed to Stuart Close. Okay, we will when we will read Stuart Close, we will discuss that. But in Hahnemann's observation that this artificial disease, too much employment of inappropriate medicine is actually decreasing the susceptibility and needing a repetition and needs a repetition. So in cases spoiled with allopathic medicine, I used to prescribe indicated medicine, be it nux vomica, be it Hepasulf, be it any other medicine indicated by the signs and symptoms plus the history. Okay, I repeat in lower potency, 6 and often repeated. Okay, with most of the cases of allergic rhinitis you are getting these days have been spoiled with the treatment of anti-allergic for years duration. Okay, for last 2-3 years patient is taking anti-allergy, patient is taking atropine nasal drop, and for that patient is having atrophic rhinitis. There is loss of sensation to smell. There are many more problems are there due to use of these medicines. And what is this? This is an artificial kavach to the natural disease, and you have to penetrate this kavach, this shield of artificial disease before you can treat the natural disease. So I start in these particular cases without thinking of any totality. Okay, this is for your clinic also, not your viva only, not your viva table. Okay, for your clinic only, not your viva table. Be cautious of uttering the word, means be cautious of telling of totality always. Sir, my prescription will be dependent upon the totality. Okay, but in the clinic, this is the totality. You need not to look further. The patient has been spoiled with anti-allergic and the nasal blockage, atropine, nasal decongestant patient was taking, and now the problem of nasal blockage was as it is, and it was before. It is aggravated in a warm room, it is aggravated in a open air. In open air, don't think much. This is the totality for nux vomica, and start with nux vomica with lower potency. Okay, I usually prescribe 6 in these cases, 6 BD for 16 days. Okay, like this bottle. Lax Vomica 6, 1 cap twice daily, and I ask my patient to come after that. And after taking this for 15 days, I ask my patient, I used to give 2 bottles. Many a times only single bottle will contain Nux 6 and other will be containing the RS water, distilled water. And when this much is remaining in the first bottle, I ask my patient to empty this second bottle into that. That will increase the potency a slight and continue from this bottle. Okay, this is plussing method I am using in my clinic with very good results. Now when the patient will come after this, no, they will report some improvement, plus you will be able to see the glimpse of some glimpses of natural disease, and you can decide upon your prescription. Okay, this allergic rhinitis is very difficult to cure. It seems to us that it is an external manifestation, but this is a lowest manifestation of immune system. So this is a complicated miasm, a complicated disease with complicated miasmatic base. And what has ruined this case is the artificial shield of anti-allergic and nasal drops. Okay, so in these cases I usually start with Nux Vomica, and that too in lower potency. So on the so this previous employment of inappropriate medicine, okay, but also serious acute diseases. In previously some slight cases of disease, here serious acute diseases, you need repetition. One such a smallest dose of medicine in highly potentized dynamization evidently insufficient. Underline this. One small dose, underline evidently insufficient to effect the all curative action that might be expected from medicine, for it may unquestionably be requested to administer several of them. Underline this. In order that the vital force may be pathogenetically altered by them to such a degree and its salutary reaction stimulated to such a height as to enable it to completely extinguish by its reaction the whole of the portion of the original disease, that it lay in the power of well-selected homeopathic remedy to eradicate. The best chosen medicine in small dose given but once might certainly be some service, but would not be nearly sufficient. Previously in the 4th edition is sufficient. Wait and watch. But here, slowly progressive cases, you need to repeat. Okay? Clear? So, in most cases, in the last quotation I have given in the group, that was the 5th edition, the first some points of the 5th edition. First point was the repetition was allowed. Okay, one of my senior called me and told that where you have read that the 5th edition repetition was allowed. In 5th edition repetition was allowed. So I told that it is understandable. I am giving a quotation. I am giving in a very short format I'm trying to give. There should be some background to that which reader should know or might know after going through those statements, that there is a background, and those backgrounds are these 3 conditions: slight cases, young children, very delicate and excitable adult. In these cases, once repetition is not required. But most of the cases, if the case is most, then you can go on generalizing the thing. The repetition was allowed. I hope you understand what I'm trying to say, that I have actually generalized where I should have told that there are some exceptions to this rule, that repetition is not allowed in every case in 5th edition, but in most of the cases, and where the majority is, exceptions are those who are in minority. Which cases are in minority? Okay, so these cases are in minority, but the majority of the cases repetition is needed according to Hahnemann. So this is the reference to that statement. And if a student reading that and telling that repetition was allowed, there is no harm in saying that, provided these three condition is there in the back of the mind. Okay. Now, but the careful homeopathic physician would not venture soon to repeat the same dose of the same remedy again and again, as from such practice he has frequently experienced no advantage, but most frequently on close observation decided disadvantage. He generally witnessed aggravation, and even the smallest dose of the most suitable remedy which he had given one day when repeated the next day and the next. Now, in cases where he is convinced of the correctness of his choice of the homeopathic medicine, in order to obtain more benefit of the patient than he was able to get hitherto from prescribing single small dose, the idea often naturally strike him to increase the dose, since the reason given above. One single dose only should be given. And for instance, in place of giving single very minute globule motion with the medicine in the highest dynamization, to administer 6, 7 or 8 of them at once, and even a half or whole drop, but the result was almost less favorable than it should have been. It was often actually unfavorable, often even very bad, and injury that in patients so treated it is difficult to repair. The difficulty in this case is not solved by giving instead lower dynamization of the remedy in large doses, thus increasing the strength of the single dose of homeopathic medicine with the view of affecting. This is actually, read this footnote by yourself and ask me if you are finding some difficulty. Now come to paragraph number 9. Paragraph number 9, that is important. Paragraph number 9 of this footnote. Now go to open paragraph number 9 of Organ of Medicine and go to Posology. Go to Posology chapter of Stuart Close. Okay, 192. 192. These 5 conditions for choosing a potency is given there. Number 1, the susceptibility of the patient. Okay. Number 2, the seat of the disease. Number 3, nature and intensity of disease. Number 4, the stage and duration of disease. And number 5, the previous treatment of disease. 3 related to disease, actually 4 related to disease and 1 related to patient. Okay, PD4. PD4, the susceptibility of the patient. Choice of remedy will depend upon susceptibility. If susceptibility high, potency will be high. If susceptibility is low, potency will be low. And who will decide the susceptibility? The signs and symptoms will decide the susceptibility. If you are getting a clear-cut picture, characteristic symptoms and clear-cut symptoms, that means the susceptibility is high. If you are getting fever, high fever, susceptibility is high. If you are getting allergic rhinitis, susceptibility is low. No clear-cut symptom, just naak diye jol porche ar kichu na. Okay, susceptibility is low. The susceptibility of patient, the seat of disease, the nature and intensity of disease, stage and duration of disease, previous treatment of disease. Previous treatment of disease will decide. Previous treatment of disease will decide the choice of potency. I told you that if previously patient have been abused with allopathic medicine, susceptibility has low, and that will cause a low potency to be selected. Clear? Now, keeping in mind in this 5 point are often been asked in your MCQ examination, be it UPSC, be it NEET, PG. Okay, you will be asked about these 5 points. Now I will read this aphorism number 9 of this paragraph. Paragraph number 9 of this footnote. I perceived it in order to discover the true middle part, we must be guided as well as by the nature of different medicinal substance. As also, underline, different medicinal substance. The part of medicine has been missed by Stuart Close. You just add here the 6th point, different medicinal substance. Okay, if it is nosode, if it is crude substance which have no medicinal effect like lycopodium. If you are giving lycopodium in mother tincture, it won't work because it is inert nature. What lycopodium have been used previously? It was used to cover, to wrap the medicines because it is inert in nature. Club moss is inert. Okay, in its crude form, it is inert. Inert. Silicea, what is it? It is inert. It has no medicinal effect, no medicinal value. Silicea, if you are giving it in low dilution, it won't work. Okay, so medicinal substance depending upon nosode. If you are giving it that lachesis poison, if you are giving it mother tincture, patient will die. Okay, so the medicinal substance, type of medicinal substance will also, that should be included here as a point number 6 in Stuart Close. PD4M, that is nature of medicinal substance. As also by corporeal constitution of the patient, that the susceptibility of patient, corporeal constitution of the patient, magnitude of his disease. So that, to give example from the use of sulfur in chronic diseases, that is magnitude of disease, corporeal constitution, magnitude of disease. Okay, and sulfur has been used as an example. Okay, read it, read next by yourself, read whole the paragraph, and where there is 10, multiply Roman 10. Everywhere the Roman number should be multiplied with 3 in organon of medicine. 10 means 30. Where there is 20, that means 60. Okay, and that is the highest potency, highest possible potency have been mentioned in organon. Okay, where there is a Roman number, multiplied by 3 to get exact number in English system. Okay, 10 is here 30. So example of sulfur I have given, and you read it by yourself. And now 246 carries an appendix also. Read that appendix also. That will be an assignment for you before going to next lecture. Just read this aphorisms paragraph, footnote, plus appendix by dozen, plus one more thing, the, I think it is in pharmacodynamics, Hughes pharmacodynamics appendix, Hughes pharmacodynamics appendix. Okay, read that too, and it will, you will have a clear-cut idea of Hahnemannian posology. Okay, so before we conclude today, I want you to keep in mind one thing, that this Hahnemannian posology revolve around two things. Okay, from, this has been discussed before also in very initial classes, from 1796 to 1843. Okay, from crude doses to LM, Hahnemannian posology have revolved around two things. Number one, to increase the rapidity of cure. Okay, to increase the rapidity of cure. And number two, to decrease the homeopathic aggravation. Okay, this should be impressed upon your mind, that whole of the Hahnemannian posology revolved around these two things, to increase the rapidity of cure and to decrease the homeopathic aggravation. And finally we are getting the LM potency. The LM potency was the result of this quest, how to reduce the homeopathic aggravation and how to increase the rapidity of cure. Where it is possible, the cure should be done in less than expected time. Okay, clear? So this, if you are, okay, one second. So there was a call, sorry for disturbance. this paragraph you should read before going to next lecture. You should read this footnote, you should read the Duggan's appendix, and you should read the appendix in pharmacodynamics of Hughes, and you will get an idea of doses of homeopathic Hahnemannian posology. And we will start from next day onward from Stuart Close. Okay, we'll go and start from Stuart Close posology chapter, and then we will come back to organon again, and then we will go to effects of remedy from different books, Kent, Roberts, and Stuart Close, and organon itself, the science of improvement. Okay, thank you. If you have any question, you can ask me in the group or ping me personally. Thank you for giving your attention.